I
This
just want to
conference will
say
now be recorded.
thank you. I just want to say thank you for those who have been coming. And then I would like to say welcome to those who are new. Um, one second. I'm sorry. You good? Okay. Welcome to those that are new. Mr. Darius, I just want to kind of point out we received an email from a lady today, and she basically referred him, and he is will be a great exit to this committee because he has a lot of networking going on, and his drive and motivation to help the community is wonderful. So I'm very excited to see and hear what he has to offer. But I do want to say that um, this would not be possible without you guys. I feel like, everybody here brings something different. And I am truly honored and appreciative to everybody here that takes the time out to even come to the committee meetings and give their expertise and, while we're moving forward in all of this. So without you guys, this wouldn't even be possible because I don't know it all. And I am depending on you guys to help out with that so that we can service the people in the community and help people live a more equitable lifestyle, so help everybody. All righty, so let's go ahead and start. I'm sorry, 1 second. Okay, so I just want to go over. So this is just the welcome. We're going to go over, have a recap over last month's meeting. We're going to go over the health indicators, framework, our recommendations, and we're going to talk a little bit about the community listening sessions, and then we'll just open the floor for open discussion. So, for the meeting recap, last month we talked about our indicators. For those that were here, it was the spreadsheet that we had, and we kind of, which I'll have a slide with that, which we talked about what was most important as it relates to health. And then we did a little bit of brainstorming, and then we talked about good versus bad policy. So these were the health indicators. I want everybody to kind of just take a look at them because we're going to be going over our short, medium, and long-term goals from these health indicators. So we talked about medical mistrust, accessibility, affordability, and then stigma, and everything underneath is what you guys um, said that hey, these are the most important things under each one. And we kind of made some changes. We added, took away. So these are the things that everybody kind of mentioned what would be best as it relates to health. And then we also talked about framework. And I just want everybody to know that we are working on a framework. This is the what we have right now. It's not set in stone, but it's the policy framework. For those who don't know, we also are looking at reviewing policies. So we can come to different organizations and look at policies and make it more equitable for your organization if that's something that you guys want. So it's kind of twofold the things the services that we're providing. So this is the framework that we're working on, and we had said that we were going to have one set for you guys to look, but it's not quite set. We have to get it approved, but this is what we're where we're at with it right now. So I just kind of wanted to share that with you guys. But the bulk of our meeting is going to be talking about those short, medium, and long term goals. So it's gonna be heavy on discussion. So as far as the medical mistrust goes, I took from those the indicators, the spreadsheet for short, medium, and long term goals. I just put under short, and let me go back so everybody can be on the same page. The short term goals are all the goals that we are looking at that take place that can be done within the time of this grant, which is for about a year. So May of next year, these are the goals that we think that we can tackle. And then our medium and long term goals are going to fall outside of those time frames. However, given that this grant may be extended, um, the short term goals can kind of change, but just as of right now, we're looking at our short term goals being something that we can tackle within, you know, I would say 6 months or so, because we want to be able to go out and talk to the community, get feedback, come back to you guys and say, hey, this is what's worked, this is didn't work. What do y'all think? Should we make some changes? So, just from you guys and y'all's expertise, I put for short term goals and based off conversations that we've had was a lack of cultural competencies training. I feel personally that's something that we can tackle head on, and it can be something that can be done within 6 months to a year. And then under the medium term, lack of transparency, preventable medical errors, COVID 19, patient experience, use of electronic medical records. And then long term is the nursing and physician shortage, not enough time with patients, lack of provider diversity, and then lack of privacy. In terms of medical mistrust, what do you guys feel about those goals? Do y'all agree? Should something be changed, added, moved around? Just based off this, what do you guys think?
I like where they're at. They all seem logical to me.
Okay. Anybody else? Because it's very important that, I want to make sure that this is right. Because once we get done with this, we're going to start basically writing things down and putting things on paper and implementing the actual plan. So, is everybody okay with the medical mistrust goals and where they're placed?
Yes, ma'am.
Okay. And moving on.
I agree too.
Okay. Oh, and hey, y'all. Matt and Wendy, welcome back. John and Carrie.
Thank you.
Hey. All righty. And then for accessibility goals. Now, these are all everything that's under accessibility. I did not feel like anything was short term. I could be wrong. I could be wrong. So, you guys looking at it, what do you feel? Because I felt like all of this was either medium or long term. I don't feel like I have to read to you guys. Y'all can kind of see it.
What time frame are you using for short term, medium term, and long term?
Short term is going to be 6 months to a year. Medium term, it falls outside of that, as and long term does as well. So we're looking at short term within this grant, which the grant is only for a year. So we're looking at it for that. But then medium and long term, there's really no set time, but it's going to fall outside of the 6 month to a year.
Uh, the one thing I would say is the transportation issue
Mm-hmm.
is a yesterday burning platform, gotta fix issue. It's the number one barrier to accessing care. And if we're going to wait that long to address transportation, none of the other stuff matters.
Okay, so it's not so much addressing it, it's being able to actually put it into place and have it working for us. So not having that be an issue. So do you think it should move up to medium
I would move it
or
to short term.
okay, so if we move
And
it to
again,
short
I look at it a little bit myopically, but the 911 calls that we respond to, where people say
mhm
I called 911 because I didn't have a ride to the hospital, is
mhm
like 20 or 30 a day.
wow. Okay. So short term transportation, do everybody else agree with that? Because I'm just honestly within a year, I think we can put something in place as far as getting more services, but transportation, we that is its own. We have a person over transportation here as well, and that in itself is a huge issue. That's why it actually has its own committee because there is a disparities within transportation. um, I'm not sure if it can be tackled within a year, but however, I believe that is nothing wrong with us trying. Did he leave? Okay. Anybody else feel like transportation should go into short term? No? Yes?
I do.
Short term?
Yes. Yes.
Okay. Okay.
Short term.
Okay. And with the short term, Wendy, how do you think we should tackle that? Do you have any ideas? I'm not asking you to know, but do you have any suggestions perhaps?
Well, I know I'm not sure which location you're targeting for Tarrant County altogether, but I
Mhm.
do know Arlington has a major issue with transportation. And then
Mhm.
with like 76104, which 76105 in Fort Worth, I do know that transportation is probably an issue there. And there's only JPS, and that community just does not trust that one doctor in JPS.
Mhm.
And so there is a huge need in 76104, especially the Morningside community, for insurance, for transportation, for trust, for knowing how to access the portal, because now it seems like every hospital has their own sign in portal and you can't get any information unless you're on that portal. And a lot of people just don't have access to computers and they can't see the letters on their phone or they don't have Wi Fi. Um, so there's anyway, I can keep going and going, but I'm not good. But I would say
It's
those two areas for sure for transportation, and I'd say definitely make that into a short-term goal because it's one of the bigger issues.
okay. And then with the medium and long term goals, do you guys agree with the rest of those or should we move some around as well? Is everybody okay with the rest of them? So just transportation should go to short?
Well, no, I would say that health literacy
Mhm.
needs to be on a short-term goal because number one, it's getting people in for preventive care first and foremost, and not waiting until they feel sick or not waiting until their cancer is so far along because they waited and they didn't go to the doctor or they did home remedies. I mean, every culture has their thing, right? And so not
Mhm.
everyone, based on culture, based on religion, based on socioeconomic level, they don't realize the health they don't have health literacy and the importance of, for instance, going to get their teeth cleaned every 6 months and their oral hygiene and dental care because that can lead to other physical illnesses, right? Stomach
Mhm.
issues, um, high blood pressure, diabetes. They wait and they don't get medication, so they get worse, and then that in turn makes the medical expenses a lot more and a lot higher because they didn't take it seriously or into consideration. when they should have. So I would probably put health literacy at the very top. I'd say transportation is also really important. Um, with everything we're seeing in the news, mental health is a silent illness. You can't see it, you can't taste it, hear it, feel it. It's on an individual basis, and
Mhm.
so mental health is not just giving the resources for the one that is suffering, but also to family and friends to see the signs for
Mhm.
someone else.
Right.
So and then I guess for everything else, I'd keep it the same. I'd keep lack of insurance coverage in the medium. Um,
Mhm.
technology, telehealth, I'd keep it in in the medium, but again, it just depends on different locations within Tarrant County have different access, right? Not every
Right.
community is the same. So I'd probably leave that in the middle because you'd have to dig a little bit deeper with that. Dental care, there's a lot of dental offices throughout. It's just a lot of people shy away from dental care because they think it's just really expensive.
Mhm.
Uh, appointment scheduling, I'd probably put in long term, or because I don't really understand what you mean by appointment scheduling. And then long term, the nursing and physician shortage. That's 100%. I mean, I work at Cook Children's and there's over 600 positions available. Um, and then childcare. Right now, childcare they have CCMS, and they're getting people in fairly quickly from some other committees that I'm on.
Okay.
So that's kind of how I would you know change it up. But anyhow, that's all I'm going to say because I'll take up your whole meeting. But I
Oh
thought I'd
Lord.
chime in.
No, this is fine. So I just want to let everybody know that all of these, the goals are important for sure, for sure. Um, but when we're looking at the goals, and I agree with some of the changes, Wendy. I just want to make sure everybody know in terms of accessibility is what we're looking at, and then it's something that can be tackled, completed, done within a year's time. Is what short term is for. Medium, I can say, maybe a year and a half, and then the long term could possibly be like 2 years. So when we're looking at the goal, in terms of like short, um, I didn't, as far as, let me see, one of them, like health literacy. We can, teach, provide classes, trainings, different resources. We have to reach the people first. We have to first say, hey, come trust medical providers. Come see what we're doing. Come even interact with us first and foremost. Then we got to say, okay, they're here. We finally got them to kind of come and check us out. Now we can go in and let them know what it is that we're trying to do. And then, hey, we don't want you to just wait to come to the doctor when it's too late. We want y'all to start coming sooner. But then it goes back to the transportation thing. What if somebody who wants to be there can't come because of transportation? So when it comes to health, it's like a snowball when dealing with all of these different issues. And that's why, when we have the goals put in place, we're really, as far as short term, it's a year's time. So going back to like the transportation, I don't know that that transportation issue will be solved within a year time. It would be great. I mean, we're definitely looking into it. It has its own sector here, but I personally don't know. But I can be hopeful, and I can feel like, okay, we can put the boots on the ground, but it can't be just me and a couple of people coming in and saying, hey, we want more transportation. So it has to be a plan in place, and then that plan has to be approved, and then so on and so forth. So hopefully, if enough people advocate for it, we can get something done. But like like you said, Arlington, they don't even have public transportation for their people in their community. So it's just one of those things to think about. But I do believe, as far as mental health goes, it can definitely move up. So I'll agree with that, and I'll definitely make those changes. Does anybody else see any other changes that, with their expertise, that you guys think could be moved around as far as accessibility?
If you Don't mind, I wanted to chime in. So just listening to Wendy, I agreed with everything she said. Of course, the transportation is a hard thing to
Hmm.
tackle. We all know that. Health literacy, that may be if we can provide some type of resources that are no cost to the people, which of course I'll tell a little bit about what I do. And lack of health insurance, my organization also assists with that. So we
Okay.
can assist with both of those things. But I think health literacy probably can be more of a shorter term goal than transportation just because it wouldn't take as much resources for that
Okay.
particular effort.
Yeah, I agree with that as well.
I agree
Would you
with
like?
that too, Darius. That's great.
Okay. Mr. Darius, would you like to go ahead and kind of share with everybody what you do because you
Yeah.
are a new member here?
Certainly. So, my organization, we're actually called Pride Life. So, the program that I work with is the Community Health Insurance Program, the SHI program. If you haven't heard of it, we assist formerly incarcerated individuals or underserved communities, rather, in getting enrolled in health insurance through the Affordable Care Act. We give them knowledge and we actually get them enrolled in no cost or low cost health insurance. The reason why my company is called Pride Life is because we deal with LGBTQ organizations, and they entrust us to enroll their clients into health insurance plans. They actually cover the monthly premium for most of their clients in the Ryan White organization, if you all are familiar. But we deal with them and they entrust us to sign their clients up in the proper plans covering their Biktarvy, Truvada, Descovy, and making sure that their doctors are covered. So dealing with the formerly incarcerated individuals and just the general public, we're just looking to put them into a plan that's going to cover their doctors for no cost or low cost. But of course, dealing with the LGBTQ organizations, we put their clients into whatever plan they want, and we just explain it to them properly. So
Alrighty.
that's what we
Thank
do.
you.
Yep.
Thank you.
Thank
I'm
Does
you.
pretty sure it's
I had a question. Does this include a dental plan too? Like
So yeah, go ahead. I'm sorry. Go ahead.
no, I was just saying. I'm sorry to interrupt. I just wanted to
Yeah. No,
like
you're not
bounce out of.
interrupting at all. So a lot of the times the Ryan White organizations, they, for example, Ambetter has a plan with dental and vision rolled into that plan, and they actually pay for the premium for the plan. It only gives the individual $1,000 worth of dental, but it's better than nothing. But they do have standalone dental plans to answer your question. Those are not $0, so those are going to have a premium associated with them. But if someone is interested, we'll explain it to them. Again, I deal with a lot of formerly incarcerated individuals, so I if they want it, I'll explain it to them. But I don't want their plans to cancel because they're just getting out. They may not have. Of course, they may want the dental, so it's just my job to explain it to them, explain the resource, and make sure that they're enrolling in proper plans. But yes, to answer your question, yes. Yep, just a long way around answering that question. Thank you for asking.
Yeah.
all right. Thank you guys. And we can go on to the next goal. So, affordability. Y'all can take a look at this one and then let me know your thoughts and feedback on this one.
I would leave everything how it is. It looks good to me.
Okay.
Uh, can can I ask a quick question? So this is just kind of a broader question about goal setting. So uh, usually when we're writing goals, right, there is kind of movement, a movement goal, meaning that we want to reduce the cost of prescriptions. We want to increase, right? And
Mhm.
so, right, when you think about writing SMART goals, right, to know if you've had movement, like the direction you want to go with them,
Mhm.
can really help with that. And so, I'm wondering if part, and again, some of it's kind of obvious, right? We would not want to increase the cost of prescriptions. I think kind of probably everyone knows that. But I think when you think about, right, writing any goals, right, a really key piece. Like, what direction are you trying to go? So even if you go back to, I mean, I hate to go back to the accessibility. So even
Mhm.
if you go back to the accessibility piece of it, right? You think about short-term goals, right? One of the things that I heard for accessibility and really affordability, either one of those are, what are the resources out there? So almost all the short-term goals, I would think, is to increase understanding or identification of the resources in the community to move any of these goals, right? So,
Right.
right, if you think about, like, so going back to Darius's comment around, right, he's a resource, but
Mhm.
he's, hopefully there's not just Darius's resource. So we hope that there are other resources in the community. So probably one short-term goal on many of these is to sort of compile, right? Not leave it to just, Wendy's commented on some things she knows in her own head. Darius is aware of some things, and I probably am aware of some things, but probably compiling, right, the needed resources around all these goals. So increase, you know, awareness of the
Mhm.
resources, and then increasing community awareness as well, right? So even if you compile like all the resources that you need to improve accessibility or access, or then on to the next goal, what are
Mhm.
all the resources there, and then how do we make the community aware? Then you can get into the trust issue and making sure they're health delivered in a health literate way and so on. So that's one thing, and you're welcome to move to the next screen back to where you were. But
Mhm.
that's something to think about, right? Is, do you want to increase it? Do you want to decrease it? Do you want to, increase access to it, increase awareness around it, right? So is the goal to reduce cost of prescriptions, or is it to make the community more aware of how to reduce their cost for
So,
prescriptions? Does that make sense?
yes, it does. So, let me just answer some of the questions. Well, some of the respond to some of the things that you just mentioned. So we are going to have listening sessions, and that's how we're going to be getting the community involved. So I'll talk later about that. And then when we're making these goals, the big thing is the biggest thing is, like you said, is creating awareness. That's why we are going to put in place the listening sessions. But before we could even get to there, we needed people like you, like Wendy, like Darius, hey, you guys work and in the community a lot. You guys, have a certain level of expertise that I might not have. I don't work in every area of health. So can you guys come and let us know what it that you guys can help us with to get to the people, so help them have a more equitable life? That's basically what it is. So everything that everybody says in this meeting, I write it down, I make note of it, I hear everything that everybody has to say, and I'm putting it on paper, and we're trying to figure out a plan that works for everybody. So what you're saying is completely right. So yes, we're wanting to create awareness for all our goals. That's number one for sure. But before we can get there, we want to know, what do you guys deem as most important? And so when we start having these listening sessions, we want to go with something. We want to let them know this is the things that we're looking at, and based off the XYZ, this is what's going on. How do y'all feel about it? What can we do to help better with y'all situation? So that's how we're going into this. And then that's why like I said, the listening sessions is going to be a huge, huge thing when we start those. But before we get to those, we definitely want to have our goals set in place. So I thank you for that. And for the affordability goals, the cost of prescription, we want to know. I put it as short because we want to, awareness, and then we want to be able to make it more affordable. In a previous meeting that we had a few people talk about prescription and how doctors were prescribed, not even thinking about their patient and just writing up a prescription, and they could get a lesser cost prescription just because it's generic, but a doctor would just write it, and they're giving it to a person who can't afford that prescription, and it's like a hundreds of dollars difference. So we definitely want to lower cost of prescription. We definitely want to make it, um, you know, create awareness of how it can be cost efficient for everybody. So that is one of the goals for sure. That's
Sometimes
why I put
the
it short. Huh?
sometimes the pharmacist will give you that option to buy generic if there is an opportunity to buy generic.
Mm-hmm.
Um, just throwing that out there. But it just depends on the pharmacy and if they feel like they're going
Right.
to try to help you save money. It depends on the person on the other side of the counter
It
versus
does.
the doctor just going ahead and prescribing cheaper money. But there are these little cards that I've seen out in the community when I've done health fairs and things like that with Cook Children's Health Plan. Um, for those that don't know, I offer Medicaid CHIP and Star Kids, which is Medicaid for medically complex care needs. Anyhow, I've seen these little cards that they can use. They're like discount cards that say RX on them. Has anybody else
Hmm.
seen those?
Yeah, I've seen
Yes,
them.
certainly.
Hmm. So that's why that's a short term goal because it's already a lot going on with the cost of prescription, and it's easy. I feel like one of the easier things to tackle and can be tackled within a year's time. Um, as far as medium and long term goals, I think y'all said y'all were good with this, or no, I think this is the next slide. So as far as affordability and as far as medium and long term goals, do everybody agree with the goals here, or should we move some around?
I would say maybe connecting to community resources and organizations can go into a short term
Short.
goal,
Yeah,
or at least there's aspects of it that can be short term, and then you can build like longer term, medium and longer term updates.
yeah, I was looking at that. I think it could definitely be short term too. Anybody else? Everybody agree?
I agree.
Okay. Okay, we'll move on to the next goal. Stigma. So we talked about stigma, and in terms of health, stigma, I guess, causes people not want to get help due to negative stigma period. So when it comes to stigma goals, I didn't see anything short term because it's a stigma. Uh, Usually when there's a stigma, it's something that people just feel deeply about, and it's got a lot to do with trust. So as far as short term goals, do you guys see any of these could potentially be in short term goals and we can break the stigma of any of these things within a
I
year's
think that
time?
there's more. Yeah, COVID-19 vaccine should be in the short term because people know a lot more about it now that we've been in it for so long. Um,
Okay.
I would move that to short term.
All right. Anybody else? All righty.
Well, I have some. I don't know if it fits, but just the stigma about insurance. A lot of this is due to people thinking that insurance is affordable or not affordable, or because I know people who I actually spoke with someone whose uncle didn't go to the hospital because he was afraid of the bills. Basically, he was willing to buy drugs off the streets or whatever just not to go to the hospital. So there's certainly a stigma behind that, you know. So yeah,
Insurance.
crazy.
Yeah, definitely. So would you put that in medium,
Well,
short?
it,
Because
it
I
just
can
depends
definitely
because
see
it's
that.
it's so many because there's Medicare, there's Medicaid, there's Affordable Care Act. So I mean, which type of insurance are we talking about? So, but just wanted to bring that up. I didn't see it, but just the stigma around it's not affordable, or when you hear insurance, it's like you're gonna get robbed, you know.
Right.
Yep, and that would
Okay.
that would that would stop a lot of this. COVID-19's vaccinations are free if you have insurance through the Affordable Care Act. I mean Medicare. You know, there's not Affordable Care Act, but Medicare Advantage plans that cover a lot of things that you don't have to pay anything extra for. So just knowledge, just that basic knowledge, would
Right.
help a lot. Yep, that's all.
Okay. Well, I can definitely add it to stigma. I mean, I don't know where. Do anybody else kind of know where insurance will fall under as far as stigma
You don't
goes?
necessarily have to add it, but it's definitely a stigma behind it, I believe.
But
Yeah.
it is, yeah. But these goals came in place, when everybody, Kylie said long term, when everybody kind of just got together and was throwing some things out there. So you wasn't here, so we didn't get your expertise on it.
Gotcha.
So, but yeah, I definitely can see insurance being a stigma as well. Okay. And anything else on here you guys feel that needs to be moved or added?
Um, Hi, I'm Dion. Kind of piggybacking off what Darius say. I know on the other slides you have physicians on there, and so
Mm-hmm.
there's a lot of stigmas about physicians as far as like when they're prescribing meds or certain communities or ethnic groups feeling like physicians don't take the time to listen to them or get to like kind of respond to their concerns. So
Mm-hmm.
that could like kind of deter like someone wanting mental health or just like all around healthcare if they feel like, physicians are only there to like prescribe them medicine and take their money. So that's kind of something to think about as well.
Okay. And you said, now, are you saying that in reference to just people in general, or are you referencing that to a certain culture,
I'm
or
referencing
just,
that to like vulnerable populations in general.
okay.
Um, So just working in healthcare, um, behavior hospitals in general, that's even if you social media, honestly, there's a stigma behind like physicians or, not being heard, not being seen, or physicians not taking the time or being prescribed things and not really feeling like the doctors hear them out when they have
Okay.
concerns and stuff like that.
Okay. So are you saying it's a stigma in that as regards to people not feeling it? Because I know we got lack of transparency, and we put that. I can't remember which goal it was under, but it was a goal. But you saying we should add that to stigma as well?
Yeah, like if you're not really educated on it or, know any information about it, I mean, it could be a stigma. Like you can have somebody who just don't go to see the doctor because they feel like, oh, they're just going to prescribe me something that I don't need, or
Hmm.
oh, they just want my insurance money. They're going to get me in and out. So just kind of education behind that as well.
Okay. And I guess I can put that maybe under medium term, because that is something that people battle all the time, especially in the mental health um,
Mhm.
field. A lot of people, the doctors will prescribe medicine, and the patients will take it for a little bit, or they won't take it at all because they're just saying, I don't need it. That's the number one thing you always hear patients say in mental health if they feel that way. So yes, I definitely agree. So I will definitely add that. Thank you, Miss Dion. Alrighty. And so now we're here to talk about the community listening session. So first and foremost, we're trying to do it um, within the next few months, like coming up. We're trying to do it soon. And so basically, if you look at the key on here, they're all marked as far as the yellow areas are the areas that we want to tackle first. And then we have um, the other areas, which is, we are looking into those as well. But our first priority are going to be the ones that are shaded in yellow, and we're trying to see, we're making contacts. Of course, the summer with different community centers, they're kind of full, so we are making contact. If you guys know anybody or know an organization that wouldn't mind opening their doors to the community to come out, please let us know, because we'll be more than happy, to utilize that. So just keep in contact with that as well. And we're trying to also when we have the listening sessions, I think, Tanisha, you can back me up on this. They're trying to do something as far as like donations, or, when people come, we want to make sure that they're being able to get something, get certain things, maybe if it's food or something like that.
Yeah, right. Because we are not allowed to, the county cannot buy food for people. So we
Mm-hmm.
had to get donations. And that way, we do have some type of incentive. Or, some people might come with their children. Like, we definitely don't want people to come with their children and they don't have any snacks or any refreshments or anything. So, because the county cannot provide those resources, we are accepting donations from various organizations. So, if y'all know any restaurants or catering companies or just anybody who would be willing to donate so that we can have those kinds of incentives and refreshments for people, it would definitely be greatly appreciated.
And when we're looking at these listening sessions, we're taking in account, people work, childcare. Um, you know, we want to have it at a time frame where we can reach the majority. So we are looking into all of these different things. So like I said, if you guys know anybody, please let us know, because we are looking and we're trying to have these listening sessions soon, to go ahead and reach out, especially now that we established the goals. We're going to go out and, see what the community has to say and get more feedback on them, from them. The short term goals now, on all of the short term goals, what the plan is that we go out, we hear the community, hear what they have to say, and all of our short term goals, we put them in place. We basically try to reach those goals, and we come back to you guys and say, this is what we've seen, this is what we found. Maybe something needs to be added, taken away. We're looking into it. So we definitely, with the short term goal, that's why I say 6 months, giving us enough time to go out, evaluate, present what we have, come back to you guys and say, okay, this is what we found with these goals. What do we do from here? How do y'all think we should proceed? So, but yes, it's still a year, but I say 6 months just so we can have enough time to at least, get some type of feedback from our short term goals. So that's the listening sessions. Um, and outside of that, do anybody have any questions, comments, concerns, suggestions? Um, Anything as relates to what we have going on as of right now, because after this meeting, um, I'm going to, like I said, we're in the process of writing something down and putting it on paper at this point.
Are you
So
aware of the health literacy workshop that UNT Health Science Center is putting on
I'm not
next
aware
Tuesday?
of, no, I'm not aware of that.
Okay, so there's a program called HEAL,
Mhm.
HEAL, and it stands for something, but I don't know what it is right now because I'm not on that page, and I don't want to lose this one. So there's heartbeats from the womb, WOMB panel, and they are, that one passed. That was yesterday. So then now
Oh.
there's another one. It's the health literacy workshop, and it's next Tuesday, June 21st, from 6 p.m. to 7:30 p.m. It's located at UTA Fort Worth at 1401
Mhm.
Jones Street, Suite 203, Fort Worth 76102.
Mhm.
And it says, join us with Dr. Teresa Wagner from UNT Health Science Center, Safer Care, Texas, to learn practical skills to evaluate health literacy online information using a community based program that utilizes the LEGIT acronym. So, if anyone's
Okay.
interested in participating, I just got that invitation. I'll see you there.
Right. No, that's awesome. I think, learning, it never stops. So I think everybody should take advantage of it, especially it's no cost.
No, no cost.
Okay, yeah. Okay, thank you for that, Wendy.
My pleasure.
Anybody else have anything?
No, I thought
Thank
this
you.
was very productive. I'm sorry. Thank you for inviting me. I was gonna say if I was, my mother actually works at UTA. I live in Baton Rouge, Louisiana. We're from Louisiana, but so I wish I just left Fort Worth and came back. So I wish I was still in that area because I would attend that event. So thank you. But thank you for
Mm,
inviting me. I did want to ask though, so the overall goal is is to put resources together to make sure we address the community concerns, or what's the overall goal of?
Yeah,
uh,
that's basically in a short sense, yes. So
Okay.
this this whole team was put together because during the pandemic they noticed a lot of people basically started hitting um disparities like all over.
Yeah.
People wasn't, as far as healthcare goes, transportation, um, communication, and what was the other one? I'm missing something. Housing. Like all
Yeah.
those four areas was affected greatly. So this
Definitely.
plan is put in place because we see a need for it, and we want, people get equity and equally mixed up, and they think it's the same thing and it's not. We're
Right.
saying when we create a equitable plan, we're meeting people where they're at and making them more comfortable to where, they can live a comfortable lifestyle. So
Right.
this is going to the community, especially those that are struggling, and saying, okay, how can we help these people have a lifestyle that's more equitable for them and connect them to resources. So it's more of a boots on the ground approach, and we're trying to reach as many organizations, many people that say, hey, can we all
Yeah.
come together and help? And we're not just going to service just one community. We're looking at all the communities and seeing which ones lack in what areas and bringing them up to par, basically, as much as we
Awesome.
can.
Yeah. Awesome.
Yes.
Good to hear. Thank you.
hmm Anybody else? No? Okay, you guys. Well, if that is all, I'm gonna go ahead and put the little last slide so y'all can have the information. I'm pretty sure y'all already have that. But um, the next meeting, I'm definitely, I don't know if it's going to be one next month, just based off this meeting, as far as putting the goals and stuff in place. But I will be emailing everybody if there isn't one, only because we're going to start the listening sessions. With the listening sessions, you guys are welcome to come as well. You know, host them with us. Be there, be hands on. Um, I mean, we're a committee, so we're working in this together. So if you guys are interested, please email me. If you guys, later in the week say, hey, Tanya, I found somewhere that might be good, please email me those different referrals, those resources. I am definitely looking. It is hard right now because it's summer and everybody is doing things. So please, 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 if y'all hear something, let me know. Email me, call me. I'm available, and we're really wanting to go ahead and get these listening sessions done so we can hear and get back to the community and start this whole process. So, with that being said, I just want to say thank you to everybody, and I appreciate all y'all's work. I appreciate y'all giving me an hour of your day and everything that you have said. Um, we'll be making those changes, and I take everything into account. The committee meetings are not just for us and different organizations, it's also for community members. So if y'all know somebody that may benefit from this type of meeting or committee, please let me know and I will send them the link. They can join and we can get their expertise as well. So, with that being said, I will say have a good rest of the day. Stay hydrated, stay cool, and y'all be safe.
Thank you.
Thank
Likewise.
you. Bye bye.
All right. Bye bye.